So thank you very much for having me, firstly. RayPRO is a digital innovation that Rayner have been working on for the last 2 to 3 years, really. At this year's ESCRS, we launched our latest revision of the platform where we allow surgeons to use the platform with any make and model of IOL and upload patient surgery data and then track patient-reported outcomes. So the RayPRO patient-reported outcomes, track the patient-reported outcomes over a 3-year longitudinal period. This really allows quantifiable evidence of functional vision from the patient's post-surgery. So this can be used in combination with the normal visual acuity testing that you would do post-surgery, post-operatively, but really gives a much more in-depth version of functional vision post-operative discharge. Peer-to-Peer is Rayner's surgeon-led clinical education program that really focuses on the current and contemporary issues that the surgeons are dealing with in the industry at the time, and has a vast array of local language content for really supporting truly global learning. In this new edition that we also launched at ESCRS this year, we introduced KOL Corner, which boasts time-stamped direction for focused learning on a multiple amount of frequently asked questions around the industry, hydrophobic versus hydrophilic, for example, and the debates that go on around depth of focus and EDOF lenses, as well as many, many others from key opinion leaders within the industry, and really gives you the ability for peer-to-peer learning, hence the name, for surgeons around the world. Great question. So RayPRO was the brainchild of our CEO, Tim Clover, who's an avid cyclist and uses Strava a lot for recording and competing against other friends of his in cycling. And when you ask a surgeon, so how good are you? They'll tell you, yeah, I'm pretty good, but won't be able to show you any quantifiable evidence of how good they are. And really, RayPRO was to fill that gap, to be able to allow surgeons to really show how good they are in patient-reported outcomes, from patient satisfaction to expectations met with surgery, as well as tracking the longitudinal functional vision over that 3-year period, really filling that gap of long-term clinical insight that we haven't had before within the industry. Peer-to-peer was to really enhance the peer-to-peer learning that was already going on. In a recent podcast for peer-to-peer, we talk about digital innovations, and the internet, LinkedIn, and social media have really helped promote this peer-to-peer learning. And what we wanted to do with peer-to-peer was bring that all into one place and give it the sound and voice that it needs on a platform dedicated to ophthalmology. RayPRO offers a huge amount of benefit to a surgeon's clinical practice, and really, most importantly, to all shapes and sizes of clinical practices as well, right from the marketing, being able to use those patient satisfactions as a stamp of approval, like you would TripAdvisor, for example, in patient-reported outcomes to encourage others to use your practice, right through to enhancing the clinical conversations that they have with patients, allowing them to demonstrate quantifiable spectacle independence using the innovative best-in-class comparison view that the platform has. You can compare our lenses against any other lens. As I said previously, RayPRO is completely device agnostic. So you can compare our EMV lens against iHearts and Vivity to really demonstrate the spectacle independence of all of these lenses together. It also helps from an auditing and revalidation perspective. A lot of private healthcare industries across the world is having an issue at the minute with linking in with national registries or European registries, if in Europe as well. And so having that collection of patient-reported outcomes is really key, something that's happened in a lot of other clinical disease areas previously, but maybe is lacking in ophthalmology slightly. And we're really trying to spearhead the movement towards bringing up patient-reported outcomes as a clinical standard within the area. Absolutely. So when we first launched RayPRO, it was just for Rayner lenses. And actually, when we started speaking to more people in the industry, we recognized that a surgeon isn't only ever going to use our lenses. Very rarely they will have a portfolio of lenses that they prefer for different people, and we appreciate that. And what we wanted to be able to do was give them the power to track whatever lens that they like. Okay, so even if you're not a Rayner user at all, you're still welcome to use RayPRO. We offer it free of charge to anyone using Rayner lenses, but it is a device agnostic platform that you can use even without Rayner. 2024 is going to be a really big year for both of these platforms. RayPRO, we're working really hard on electronic medical record integration. So working with EMR systems, the big names, MediSite, for example, and looking to ways that we can integrate our platforms to work seamlessly to reduce any effort in onboarding at the front end. We're also looking at better integrations with our IOL calculator, RayTrace, and how we can seamlessly integrate these into one portal. So people will be able to calculate IOLs on RayTrace, order them, and then directly track their performance in RayPRO. Peer-to-peer, we're continuing our mission for a truly global platform for peer-to-peer learning. And so KOL Corner will be expanding to new languages, and as contemporary subjects arise, we'll also add those into the KOL Corner as well. Great question. Our latest peer-to-peer podcast on digital actually asked exactly the same question. And it's something, I think there's an exponential curve in digital innovation in all sorts of industries, and medical is right there, and ophthalmology is right at the top of that as well. And with the advancements in OR equipment and the interoperability, I think is the real word when we look at digital innovation in the evolving landscape. I was recently invited at ESCRS to sit on a panel discussing exactly that. The interoperability of software and digital devices, digitally enabled medical devices, is really key. And Rayner plans to stay at the forefront of this by offering to work with and really being very keen to share experience as well as data with other manufacturers and industry leaders in digital innovation, because the data that we gain is only as good as the data that we have available, okay? And so encouraging the fostering relationship of an open source platform where we can integrate seamlessly with EMRs as well as operation OR room equipment is really important for us. And so we will always stay open to collaborations in that area. Peer-to-peer is available on all major downloading and streaming platforms: Spotify, YouTube, Apple Podcasts, Google Podcasts, as well as being able to sign up for completely free 6-month trial of RayPRO at www.raypro.com.